Joining me now to discuss the debate on human rights for the unborn babies and their mothers in WA is Upper House member Nick Goiran. Nick, thanks so much for joining me.
It's good to be with you, Lyle, albeit it's regrettable that we need to be discussing this distressing topic.
Yeah, absolutely. And, I appreciate your courage in not shying away from this, because it does need the public spotlight on it. Your Health Minister, Amber Jade Sanderson, was very angry about the petition that I just mentioned, which was tabled in the Parliament. She told the West Australian newspaper, "There's no such thing as a failed abortion. There's no such thing as babies born alive after a failed abortion," end quote. Nick, is she right?
Well, she's manifestly wrong, and it's actually outrageous that this comment has been made by the Health Minister in Western Australia. More than 10 years ago, one of her former Labor parliamentary colleagues, the Honourable Ed Dermer, was the first to discover that such a thing happens, and at that time there had been 14 Western Australian babies born alive and left to die. Every year since then, I have been asking questions in Parliament about this, and the most recent answer indicates that that number has now risen to 31 in Western Australia. Now, I know those numbers are perhaps considered to be small compared to some of the astronomical numbers on the East Coast, but every baby who's born alive and left to die is a tragedy in Western Australia, and there's nothing modern about allowing that to continue.
No, absolutely not, Nick. And look, some of our viewers will know this, but probably most people won't, that the reason why we have a bill in the federal parliament now put forward by Senator Matt Canavan and Senator Ralph Babet and I believe Senator Gerard Rennick is because of the work that you and your colleague over in the East, Mark Robinson in the Queensland Parliament, did in first exposing this issue of babies born alive after botched abortion. So it's your work over more than a decade and Mark Robinson's that's led to this spotlight in the federal parliament. So I want to commend you for that. Nick, I understand that the bill that's before your parliament right now, the abortion bill, will allow abortions for any reason up to 23 weeks. What's their rationale for making 23 weeks the dividing line between whether a baby gets to live or die?
Well, it's an excellent question, Lyle, actually, because at the moment in Western Australia, and it has been since 1998, for the last 25 years, there's been an unlimited capacity to have an abortion up to 20 weeks. As you say, this bill then seeks to lift it to 23 weeks. And whilst the debate is currently in the lower house, rest assured that when the bill gets to the upper house, I will be asking precisely that question, because why would 23 weeks be the so-called new threshold? Why not 33 weeks? I mean, would the ordinary, fair-minded Western Australian recoil at the idea of the limit being 33 weeks? If so, they should ask themselves why. What might we find to be unpalatable about 33 weeks? Well, surely those same reasons apply at 23 weeks. Now, Lyle, we had a briefing from the Health Minister's office on this. Parliamentarians were offered the opportunity on Monday this week, and it was very interesting to note that at that briefing, a member of Parliament asked, what is the survival rate at 23 weeks? And the response came back to say nil. One word back to say nil. Now, yesterday in Parliament, I've asked the Health Minister, have there been any Western Australian babies born alive at 25 weeks? The answer was yes. Any at 24 weeks? Yes. Any at 23 weeks? Yes. Any at 22 weeks? Yes. So what really concerns me about this is that the Health Minister says we need to have a respectful debate. Well, there's no respect if there's deliberate misinformation being bandied around by the Health Minister and her advisors.